Hi. Yeah, you're going to have a good time with this video. This is all about how to use Uworld. They have changed. They have added like so many updates. You can't keep up with them. However, I think you're going to feel good about these updates. Now, the issue is very often students say, well, what about, can I just use Archer? No. You get what you pay for. Uworld is not paying me to say this. My PhD is preparing me to say this. In other words, a PhD allows you to analyze and research until you're blue in the face all the different things that are available for students and make sure that you recommend the best. Nobody's paying me to say nothing, okay? So get that off your chest first, because, you know, some people think, and some people are literally promoting products and maybe with lack of integrity, maybe they never even used the product. But I've used everything, and I'm here to tell you that Archer is just too easy. Uworld has a level of difficulty that you're going to need to pass this NCLEX exam. Sorry, but that's facts. Who can Archer help? People that maybe are new grads, went to a really good nursing school, never failed before, didn't graduate 10 years ago, are not English second language students. So for example, if you do some Archer practice tests and you get like a 40%, like you get a 60%, that's a 40 or 50% on Uworld because they're so different in their level of difficulty. So my preference is Uworld. That's what goes with my materials that I have on HETV. My videos and different things will fit nicely with the Uworld format. So let's get started and teach you how to maximize this Uworld because it's amazing. Now, here we go. I just told you why Uworld. Now let's look at how to set up your Uworld. First of all, you have to buy it on the internet. Even if you had it before, sometimes, you guys, if you try to renew it, it'll be like expensive, more expensive. I've seen prices like $399 for 90 days worth. Never pay that. Your 90-day subscription to Uworld, which is what I personally recommend, unless you're a student that I've talked to and you graduated 10, 15, 20 years ago, you're going to need 6 months. Just buy it and be ready for it. If you graduated, if you failed 6, 7, 8 times, you're going to need 6 months. So I'm just talking to the traditional student, new grad, or even someone who failed once or twice. So you're going to need 90 days worth. When you get that 90 days, it should be $249. Hopefully they won't go up on the price anytime soon, but it's around that price and it's 90 days worth. Okay. So you buy it, then you download it from the app. It's not enough to buy it on the internet. You will not ever maximize this software unless you download the app from the App Store on your phone. So you go to Uworld and you'll see Nursing Education. That's the one you need. Don't just click on any Uworld that you see because you're going to mess around and get some damn accounting Uworld test software. I mean, crazy. Uworld does a lot of stuff, not just nursing. Okay, cool. Now, when you set up your Uworld and you've downloaded the app, you're going to go, when you get ready to activate, you're going to activate, right? Just launch or activate, sometimes the terminology is, and you're going to see a lot of confusing things. Let me just show you what may confuse you if you're not careful. I have it on my phone. I bought a new subscription this morning because I wanted to show you just how this really works, okay? So you and I are going to go to this thing. I'm going to put my little thumbprint or facial thing, whatever. And you're going to see this, right? You're going to actually see this grid. These assessment exams that you see on here are for later. One of them will be for right now. But you're going to hit, in order to just get into the software, you're going to hit your NCLEX RN. Once you hit your NCLEX RN, you're going to see something kind of confusing. You're going to see all these weird videos, right? So the videos are nice, but you're not wanting to do those right now. That's not where you were going. You were just trying to do a test. Like, what is this, right? So go ahead and hit the 3 lines at the top. And when you hit the 3 lines at the top, now you're going to see everything you actually need to get started. And you'll see it says videos. You'll go right here to the Q bank. Okay, so I hit the Q bank and your Q bank will show you that, right? Now, the Q bank, you just hit create a test. So when you create this test, the part that students get very wrong is how to set this up. This whole page, if you don't set it up correctly, you're kind of screwed, okay? So let's talk shop. All right, here we go. When you look at the test mode, it will ask you tutor or timed. It will literally say that. And here we go. Tutor or timed. Now, it depends. When should you use tutor and when should you use timed? If you are in a hurry, use timed, because you're just going to get questions and you're going to do the questions and you're going to be done. And then you get your score. If you're using your time wisely and you have a day off and you don't have to go to work and you're sitting down with the sole purpose of studying really well today, then you absolutely need tutor. Tutor is going to give you the answers immediately and the rationales with it. That will not happen with timed. After the timed questions are done, you can always go back and review rationales, but it's not going to give it to you as you go, right? That makes sense. Now, the question type, traditional versus next gen. Clearly, if you're at your house and you're sitting down, ready to get started, let's study, you're going to put both of those. So your phone will click both. But what if you're in a hurry? Next gen questions take a while. That's why we've had students on the videos, the inspiring testimony videos, that tell you that they passed, but they did run out of time, because case studies take time. So if you're just in a hurry, you're like, look, I got to get 5, 10 questions out of the way, because you should be doing questions all the time. I got to get these 5 or 10 questions out the way so I can get my holy hookup, my little feeding for the day, you know, my nourishment for the day. Well, then don't put it on both of those. But when you're sitting at your house with the sole purpose of this whole day, we getting down with some Uworld and some HETV, then you would put it on both. Next is question mode, unused versus click all options. Let me explain that to you using my other phone, which also has Uworld, a different subscription completely. Let me show you what I mean, because sometimes what happens is you go and you're like, wait a minute. Am I supposed to click all of these or what, right? So I'm going to show you what I mean. And on this phone that I'm using now, I'm going to the Q bank, create a test, and I'm going to show you how this, what is it called? Question mode. Y'all see that? Actually, question type. I already told you question mode. No, it's question mode. Is that right, y'all? Okay, there we go. Question mode. Y'all pray for your girl. Now, this is lit up. This is lit up. This is lit up. If you're doing a random test, you want all of those. However, if you are doing mastery and you are sitting down with the sole purpose of getting through your mastery subjects, so you know how this goes if you know my program, psych is first, renal is second. You know, you got a system here, right? You got what order to do these subjects in. So if you're sitting down and you're in your psych mastery program that I teach you, then you, of course, are going to always go to unused only, because you're trying to use all the questions in the test bank for psych. Now, let's just talk shop. Let's say that you did all of your psych questions that you were going to do, and you just got that score that you need that says, Shelly said, when I get this score, I mastered this material. Well, guess what? That was just quizzes. You still have to do a final exam. So now the final exam in psych would require that you literally hit every single one of these, because you're going to do 85 questions in psych. I hope that makes sense, because the 5 to 25 that you're doing on this phone all day, every day, and we keep it small, 5 to 25 questions only at a time, but all day, every day. When you're doing those are quizzes. Once you get the score you need on your quiz, then you can go ahead and do a final exam, which would always be 85 questions, or the most amount of questions that are available. Now, come on, we got more to do. So we did question mode, we did question type, we did unused versus click all options. Remember, unused is for mastery, click all options is for any other test you're taking. Question category. Let's move on to question category. This is where you really got to listen, okay? Here, you cannot click both. You have to choose one or the other. Now, when you're doing mastery, you're going to click, of course, the subjects, because it's going to give you those subjects. But if you are finished with your mastery and now you have already talked to me, or maybe not, maybe you didn't talk to me, maybe you don't need to talk to me. It's expensive to talk to me. It's $35 to talk to me. But maybe you haven't talked to me, or you have. You are looking right before you take your test. I tell you, 2 or 3 weeks before your test date, if you failed, you are looking at your candidate report, the categories that you got below in, and you are pulling that up right on this section here. Let me explain. So you go here and let's have fun. Let's choose that category of clients' needs. Let's take every single one of these and click whatever we can. For the sake of teaching, let's go ahead, make sure it's timed. And because timed is like, let's get this done. And then traditional, because, this will take too long. But if you're studying and you have the time, well, then of course, tutor, because that's going to give you the answers right away, and hit both next gen and traditional. So let's just go to the next slide. The next slide is the most important thing if you ever failed before. Here we go. These are actually categories on your candidate report: management of care, safety and infection control, health promotion and maintenance, psychosocial integrity, basic care and comfort, pharmacologic, there's another really good one, and of course at the bottom, the reduction of risk. Now, I'm going to tell you, you guys don't be knowing what these words mean. So I'm just going to tell you a little bit of holy hookup. The management of care, I want you to remember that you're ethical legal, that's your workplace conflict, that's your who you see first, that's even roommates, that's your delegation, that is where you do your SBAR. You'll find autonomy and you'll find your ethical legal terms like autonomy, consent forms, fidelity, veracity, all those things are under management of care. It's the management, it's not the care, it's management. Okay, so staffing ratios, assignments, charge nurse duties, what impaired nurses, what do you do with that, right? Y'all got this. Now, safety and infection control is what it says. Hello, do not make me go there. However, this one, you guys don't be knowing. Health promotion and maintenance. Every time I ask you what health promotion and maintenance is, you look at me cross-eyed. Health promotion and maintenance is maternity, peds, geriatrics, maternity, peds, geriatrics and growth and development. Now, it's also cancer screenings and vaccines. That's health promotion and maintenance, okay? So kind of important. Then, of course, we have psychosocial. Ooh, I'm sorry, guys. Can you see that health promotion and maintenance and then the psychosocial and then the next one? is basic care and comfort. Oh, basic care and comfort is one of the #1 failure items on the test. So lots of people fail in basic care and comfort. #1. It is tied now with the new NGN NCLEX. It's tied with, guess what? Reduction of risk. Reduction of risk is really your procedures. Basic care and comfort is how do you care for the patient without using a bunch of drugs, okay? So those two, you know, we have videos on all this stuff, so don't worry your Jerry curl. I got you, but you got to know what these are, okay? So if you failed in basic care and comfort, join the whole world. And if you failed in reduction of risk, know that that's your procedures. What procedure, Shelly? Well, blood administration, IVs, central lines, eardrops, eye drops, dialysis, Foley insertion, enteral feeding tubes, trach care, your positioning, oh my God, it's everything. It's AccuChecks, it's topicals, it's how do you put on TED hose, it's how do you make an ice pack, MRI, MRI, CAT scan, EEG, EMG, TTE, and TEE. Right, okay, so that's big. That's why that pink packet in procedures, here we go, because just in case you didn't know, we got a pink packet for all of it, baby. Here's your infectious diseases. Here's your procedures and reduction of risk. Here is, upside down, I think, no, management of care. Right? So, I mean, everything you need, we already got it. Your psych, okay? Your EKGs, all this shit, we already got it. Your medications, and you know what it is. Oh my God. So we got all of that for you. Just give me a call. Hell, 216-410-0936. There's always a sale going on with those pink packets. Just say, I need them pink packets, Shelly. Okay, so anyway, let me show you something that is another one that's very confusing. The very last one says physiologic adaptation. Let me tell you what physiologic adaptation is, because that's the one y'all be doing kind of like crazy on steroids with. Physiologic adaptation is a deeper understanding of disease process. In other words, if I ask you, and I can't believe how many people don't know the answer to this, but if I asked you what causes cirrhosis in most people in America, and you don't know that answer, that's physiology. Some people call it pathophys, physiology, the how and the why shit happens. Physiology, okay? So if you said alcohol, you're halfway there, so that was good. That was the answer to that question. But then if I said to you, what causes the cirrhosis patient to have ascites, and what is that? And you said, well, that's fluid in the belly, but I don't really know what causes it. Well, that's the wrong answer, right? You would have to say portal hypertension and the fact that the patient's albumin is low, and albumin is used to keep the fluid in the vessel, but there is no albumin, so the fluid's coming out of the vessel, and because of the pressure from the portal hypertension, it's just oozing right into the peritoneal cavity. I know, right? Hard. But that's what you got to know for this test. That's a whole category, for crying out loud. So in other words, beloved, Uworld has got your back, just like I do. So when you get down here and you're looking at question category and you're trying to determine subjects versus client's needs, the client's needs are going to be based on your candidate report if you failed before. If you're a new grad, you don't have anything to judge whether or not you're going to suck in those subjects. So what I suggest to you is you go ahead and do questions in management of care, basic care and comfort, procedures, which is your reduction of risk, because those are the 3 top dogs on the whole test. I hope I made myself clear. Now, we're already down here. We're doing pretty good, but we're not done yet. No, honey, because we're trying to set up a test. Remember, we're trying to set up a huge test for your behind. Here we go. Let's look at it again. All right, now, so I'm going to go here and I'm going to choose subjects because I want to carry on with the video now, child. You go to next. You saw next. Okay, good. Now, here, very important, critical. Okay? This actually says subjects. Always select every single one of them. Watch this. Always. Watch this. Boom. All of them. Select all. Y'all good? Good. Okay, now go to next. Next, look what that is. That's systems. You already know this is long, very long, because there's so many systems, right guys? So this is where you choose your system. In my program, I expect you to use critical thinking. So I have in my packet that, in the Oh My God packet that a lot of you guys have already, because when I first started, I was giving it away for free, just, nice little hookup for the babies. But then you guys got out of control and I started getting 700 requests a day. So I started charging. Okay, now it's only 500 requests a day. And then I had to put the price up because you guys were still out of control and I can't do all those orders that fast. So, okay, fine, I get 400 requests a day. That's why you gotta wait 72 hours. Give me a chance, please. Okay, but me, I'm trying to hook y'all up. So if you look in the Oh My God packet, one of the things I tell you to do first is psych and psych meds. Now, sometimes y'all don't be critically thinking. I can't find psych on Uworld. And this makes me just want to slap you and pull out your eyelashes one by one, because it means that you did not critically think that through before you text me with that bull crap. Because here, honey, let me help you with this. Here is a list of subjects. When I say psych and psych meds, hopefully your crazy behind knows it's right here with mental health. Hello, right there, y'all, right there. But nah, you want to tell me how you can't find it. Now, when I say psych and psych meds, I said two things. So it's not just mental health, but it's one of them. So we're going to click on that. We clicked on mental health. Now we said psych meds. See if you got anything in here to say. Psych meds. Boom. All right. So what did I just say? Watch this. Systems choose 1 to 2 only. You never gonna choose all of these unless you about ready to, take a test in the next couple days. But there's a reason why I don't tell you to do that. We do it in class. We do quizzes in class. So if you're in my class, we definitely would be selecting all, selecting all, selecting all. But when you're at your house, there's a better way to tell if you're ready. And we're gonna get into that in a minute. All right, so we're good, right? All right, let's hit next. Now we're here and you guys get goofy sometimes. So you have to hit that to bring up the bottom. Then you have to scroll to what you want. Now this part is very important. When you set up the number of questions that you're doing, please don't let me hear that you out there in a community somewhere choosing 50, 85. The software only goes up to, let me make sure you see that. It only goes up to, do y'all see that? I don't know if y'all see that. It only goes up to 85 questions. Oh, hell no. The only time you use an 85 questions is to see if you've mastered a subject after getting a score that you need. After getting the score that you need using the quizzes, you're only going to use that 85 questions to do all the psych meds this testware has available. Okay. So what is going on with the questions? So what's going on with the questions is you don't want to use any more at a time than 25 questions. I personally prefer 5 to 10. Keep it tiny, keep it bite-sized. That way you can review the rationales and take notes on them. Okay. All right. So that was how you set up the test, but we're not done yet. So earlier today, I was looking in my little deal here, and I want to show you how to name a test. So one of the things we're going to do is we're going to go back to Uworld. And the thing is, you got to go all the way back. So if you get lost with what you're doing, always go to the 3 lines. 3 lines, 3 lines, 3 lines. When you go to the 3 lines, you're going to need previous, When you go to the 3 lines, you're going to need to hit previous test. Previous test. And let's choose one of these tests. I'm just choosing one of these tests. Now look. Do you see where it says resume test, start review, analysis, edit test name, edit test mode, blah, blah, blah. Okay. Edit test name allows you to name that test. If you were doing my program and you are in the first subject, you would use a big capital M, and then you would space and use a capital letter. And some of you are cute because you don't know how to spell psych, but that's how it would look like. Mastery for the M, psych. When you do your 85 questions, then you do this. Final. You see that final? To represent the fact that that's your final exam in psych. Are y'all good about that? I hope that helps, because if you name your test, you can go back and look at some of those tests in preparation for what? NCLEX, because all you got to do is look at what you missed and brush up on it. It's kind of cool. All right. Now, look at here, guys. Uworld has something called test analysis. Let's have fun and go do a test analysis. So what do we say you always got to go to? What do we say? Them damn 3 lines. 3 lines. Here we go. How do we go do a test analysis? We hit the previous test, and we're going to analyze this test, and it probably says something over here about analysis. Oh, there you go. So there was a 90%, and we have something called test results, which is easy, but we have this, which is what I'm talking about, a test analysis. So we have a 90%. Then down here we have difficulty level. Ooh. So what difficulty level does it say? It says your questions were medium difficulty, and it's somewhere in the middle of the bar. It's not way over here or way over here. Then it says answer changes. Let me tell you something. Score, we just covered it. Difficulty level, we just covered it. Answer changes. The problem with some of y'all is that you keep changing your freaking answers. And let me tell you, Uworld got your number. Because listen, if you changed your answers, and look, it says you were correct and your dumb ass changed it to incorrect. Who I'm talking to? I'm talking to somebody, because some of y'all just be, that ain't right, let me change it. If you look, how many times did I change that answer? 0. Yeah, because like, for real, like I'm not changing no answers. You stop it too. You cut it out. Stop changing your damn answers. I hope I made myself clear. Anyway, moving on. Then you will see it will isolate what subjects you had, right? And it'll talk about your, what does that say? Oh, subjects, critical care, and a bunch of other shit, right? You don't care about that. No, you don't care. What you do care about is score, difficulty level, answer changes. Last but not least, almost last, we have the Uworld videos. And the Uworld videos, the good, the bad, the ugly. Because, you know, everything has a pro and a con, right? All right, what's the good? Oh my God, it's so good. It's short, they're quick, and they're actually pretty damn good. In other words, if you are a new grad, this is you, boo. This is you, honey. You're going to be fine. The bad. Oh. Can I keep it real? Can I keep it 100? Because you know I don't lie. I don't lie. I can't lie. They're boring! Yeah, they're boring. There's no dancing. There's definitely no cussing. We know there's no cussing. And I know that's why you come see me, because I cuss. I know that's why. I know. So there's nothing. There's no highs. There's no lows. There's no, oh my God! There's no stories. There's nothing. Boring. The other problem, but not that bad, especially if you went to a good school and you just graduated. Everybody else, listen to me. They're supplemental. Yeah, they're not a lecture. Oh no, they're definitely not deep physiology, pathophys, right? They're not case studies. They're just quickies, and there's nothing wrong with that if you went to a good school and you came out and you had really good grades and you're just trying to refresh your knowledge. It's an excellent situation for that person. I don't know them people. I don't get those people. I get really high-risk people that failed 15 times, that graduated 13,000 years ago, English second language students, or whatever. I don't see the new grad. I don't need to see the new grad. I teach NCLEX. You don't need me if you just graduated from a good school and you have a halfway decent understanding of this product. You will be fine. Uh-oh. Y'all ready? Y'all ready? Okay. The ugly. Yeah, there's some ugly. Let's do the ugly together, shall we? Here's the ugly. The ugly is, and let's go to everything that we want to see. Let's just do the damn thing. Here we go. We're starting at the beginning. We're going to hit the RN, and you're going to get right to the videos. Let's look at the ugly. It starts right away. That very first screen, and remember, the only Uworld I recommend, even for LPNs, is RN. So if you look at this, RN Uworld, which is the only thing I recommend, this says abdominal hernia, and they put it in musculoskeletal. Can you see that? I hope you can see that. Oop, shit. I done touched the damn thing. I don't want this video. No, I don't want the video. No. Okay, so there's a little star by it. It says abdominal hernia. They put it in musculoskeletal. Question. Does a fucking hernia go in musculoskeletal? Is that a bone? Is that orthopedics? No. It's GI. Hernias are GI. So that's the ugly. The ugly is that they are improperly categorized. And even though that's true, I still want you to reset this part of the Uworld. Let me show you that you must reset this. Otherwise, you're going to be real confused. So let's do it. Here we go. We're going to go to the other 3 lines. You see it says reset right in here. Reset, I guess. I don't know. Now, it says lecture name A through Z. Then it says lecture name Z through A. Now, who the fuck would categorize some shit Z through A? I'm just asking for a friend. Okay. Then it says system, right? It says system name A through Z. That's the one I want you to use. So if you go by my product and you're doing subject by subject, system by system, and you put system name, let's show you how much more beneficial that would be. Let's update it. You got to hit update. And then let's go to endocrine. Now you've got to be careful. You really got to watch what you're doing here, okay? You got to stay with your girl. Endocrine. Remember that the name does not say endocrine. The teeny tiny name underneath it does. Endocrine, 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 endocrine. And so there's all your videos. Addison's, Cushing's, diabetes insipidus, endocrine, diabetes mellitus, endocrine. Diabetes mellitus type 2, endocrine. All of these wonderful. You got your DKA, everything. So my suggestion to you is to hurry up and reset this and keep it set. You don't have to keep going back, by the way. You could just reset it. When you start out, reset it. Okay. Now, test options. Let me show you, girlfriends and boyfriends, what I'm talking about. Now, how are we going to get back where we need to go? 3 lines, right? There you go, girl. There you go. Okay, now, so you at the 3 lines, and you're going to see that you need to go back even one more for your assessment test. These are your assessments. All these are your assessments. Now, let me tell you something about the assessments. The assessments are all new questions you have never seen before in your life. That's one. The assessments are 5 hours long. Are you feeling me? 5 hours. That's 2. The assessments will expire in 2 weeks. In other words, if you didn't take your little behind and review those rationales in that 2-week period, all those questions are gone forever. So that will expire in 2 weeks. And what else I wrote down? I wrote down a little note for y'all. Oh, yeah. The rationales are given at the end. Now, the good news about an assessment test, because life be happening, life be lifing, is that when you start the assessment test, and they're usually 100 questions, when you start one of those assessment tests, you can pause it, but it's not a good idea, because what if it gets lost? So when you are ready to do an assessment test, and of course your girl's going to tell you when should you do them. Number 1, when you first get the software, do an assessment if you can. Your life might be such that you can't, but if you could, do that assessment when you first get the Uworld. You want to see where you're starting from. And since you're not in my class, I can't tell you. So just do it. Do that first test ever on this whole system. Make it your assessment test. But how do you do that? Well, remember, I said it's 100 questions. You got to have at least 4 hours, really 5, right? You've got, because it's going to be NGN and traditional questions. You've got to have at least 5 hours. You can just sit there and do that. That's called right after I send them badass kids to school. And my man has had all the pleasure he needed from me, and he done went to work. Then I'm going to sit my ass down here and do these 5-hour testing that I need to know where am I at. Okay, now, when else should you do this? Well, you should do this assessment test right before you go take your test, but it's got to be a week in advance. It can't be the day before. That's stupid. You need to do it a week in advance to see where are you, and does it even make sense for you to take your little ass on out of here and take a test? Now, here's our problem. The scores that Uworld say that you need to pass the NCLEX are all bullshit. Yeah, I'm serious, right? Because I did, read all up on Uworld. I did make sure that I covered your butt and mine and looked at exactly what do they say you need in order for you to pass this test. I did do that. And when I did that, I was like, oh, no, that doesn't sound right. Okay, so let me just tell you what I saw. And I'll just show you, because it's so much better to show you, much better than I can tell you. Here we go. You ready? You ready, boo? Okay, here we go. I want you to see this BS. Okay? Real BS. Now, I'm telling you, it's BS. Here we go. It says a score of 57%, 99%, chance of passing this NCLEX. It's all bullshit. You know it's bullshit. Why do you know it's bullshit? Because I got those students in my class. Here's the deal. Let me help you with this, okay? Let me help you with this. First of all, let's just do elementary 101. Let's just take it all the way back to preschool and a little bit of kindergarten. If you're a teacher and you gave a test today and the students got 100%, they get an A+. If they get a 90%, they get a B+, A-. If they get an 80%, they get a B+, C, or C+, right? B-. That's 80%. I hope you're staying with me. It's not that great, is what I'm saying. Now, a 70% is what? Failing in every nursing school you ever thought you'd go to. 70% is failing. But if you're a teacher and you're not in nursing school, 70% is a C-, D+. These jokers just told you you needed a 57% to have a 99% chance of passing. Bullshit! Come on! Use your brain cells. Don't be stuck on stupid and parked on dumb. You know damn well that don't make sense. And that's why I'm angry, because you guys are so gullible in terms of these testing. You're believing these experts to be correct, and they're just not. And what happens is so unfair, because you take your little happy self out of here thinking, I got a really great chance of passing, and it's all bullshit. And then you call me and we go through this whole thing together on the phone, and you know, you got to buy pink packets and you got to sit down for 3 to 6 months and do it right. And I mean, it's just ridiculous. So, you know, it's a little inaccurate. Now, that's the assessment test. There's one last thing that they have on the Uworld to help you. It's called Computer Adaptive Test. That's the type of test that your regular NCLEX, your NGN NCLEX has too. Remember that the NGN NCLEX is adaptive. In other words, it's going to dummy it down if you're missing every damn thing, and it's going to smarten it up if you're getting it all right. In other words, it's going to increase in the level of difficulty if you are getting everything right. So how do you do that? How do you find those? Because these were the assessments. Let's just go to a normal NCLEX test. You're going to see videos next. Of course, we agreed you don't need to be looking at the videos. You need to go back to the QBank, and all you had to do was hit the 3 lines at the top to do that. So we're going to go ahead and hit QBank, right? QBank. And then it says create a test. So we're going to create our test. And we did all this shit already. But look what it says at the top. It says practice, which is where 99% of the time you stay. And then it says adaptive. If we hit adaptive, it's going to tell you that this is going to increase in difficulty, right? It's going to go ahead. And then here's our thing. You are almost hardly ever doing an adaptive test, because here's the drawback to the adaptive test. You have to have over 150 unused items. So this isn't even a test you could use right before you take your NCLEX, because as you know, I teach you before you take your NCLEX, you must have done every single question on Uworld. Keeping it real. Before you go take that test, you need to do every single question on Uworld. I had to repeat that in case somebody's slow. Okay, slowing the uptake, just saying. So how would you use the computer adaptive test, the adaptive test, the CAT? How would you use that right before you go test? You really can't, because you will not have you won't have enough left over. And you need at least 150 unused items to do that. So that's like a drawback right there. It is a timed test. It's timed. Now, are you ready for this? It's the only test in Uworld that can go from 85 minimum, right? Computer adaptive, just like the NGN NCLEX, to 150 maximum. So if you're smart and you've gone and looked at my program, HETV, and you know that my whole program runs off the playlist, and you see that I tell you there's a 12-week program in there for you. There's a 12-week program in there. How to do this in 12 weeks, especially for the new grad. If that's you, then at 6 weeks, you're doing a CAT. Yeah, midterms. Yes, you guys, your midterm will be done as a CAT because you're at home. You're not in my class. I can't do anything with you. So if you want to kind of just like, really do this the right way from your house, God bless you. It's hard to learn from home. It's horrible to learn online. It sucks ass. But if you are trying, then that's what I recommend, that you do a 6-week midterm exam. Now, let me say one more thing before I get up off this damn camera. We just reviewed how to use the Uworld question bank, how to use the Uworld test analysis, how to use the Uworld videos, and how to use the Uworld test options, which include pre-assessments and computer adaptive test. Now, I'm done. Deuces. I'll see you later. I hope that helped.